Well, the study we presented was the sub-study on health-related quality of life of the phase 3 randomized study called KarMMa-3. Well, just to remind you, KarMMa-3 is a prospective randomized study that compared one single infusion of a BCMA targeting CAR T-cell product called Ide-Cel to standard of care regimens in patients with relapsed refractory multiple myeloma. More precisely, patients were triple class exposed, meaning exposed to an immunomodulatory agent, a proteasome inhibitor, and an anti-CD38 monoclonal antibody, and they had received 2 to 4 prior lines of therapy. Well, in this study, we looked at the health-related quality of life. We measured it at different time points, like when the patients were enrolled in the study. This was also measured in the Ide-Cel arm at the time of the CAR T-cell infusion. And then for the patients who got standard of care regimen, it was measured when they received the first study drug. All patients had QoL assessments monthly for 2 years. We used validated instruments like EORTC QLQC30, the myeloma module from EORTC, and the HRQoL. The major findings were that in the Ide-Cel arm, there is an initial drop in quality of life, which can be explained by the fact that patients were not allowed to receive any new treatment when the CAR T cells were manufactured. But then there was a rapid increase in their global health status that was statistically significant, that was clinically meaningful, and that was maintained over the study duration. Likewise, we also found statistically significant and clinically meaningful improvements in functional scores like physical functioning, global functioning. We saw the same with symptoms. In other words, there was a significant decrease in important symptoms like fatigue and pain. This improvement in health-related quality of life was also achieved faster, and it was also sustained in the patients who received the CAR T-cell product. So in conclusion, we believe that we have shown that a single infusion of Ide-Cel is associated with significant and meaningful improvement in health-related quality of life. We believe this study has an important clinical impact because currently the majority of treatment regimens in myeloma are of long duration, sometimes called continuously, what means that patients can be on treatment for many years. Even if the treatments are well tolerated, they still are associated with side effects and with an impact on the patient's quality of life. A major benefit from a CAR T-cell product is that it's one single infusion followed by a short period of hospitalization with side effects, which negatively impacts the quality of life. But then, when that's over, the patient can enjoy a very good quality of life. And sometimes the patient calls this even the best quality of life of their whole treatment journey.